So good evening students. Today we will be discussing about the parotid gland. So it is one of the largest of the three salivary glands. It is located in the parotid region. You can see here the ramus of mandible with the masseter muscle, external acoustic meatus, temporomandibular joint, mastoid process, sternocleidomastoid, posterior of digastric. All these are forming the parotid bed. To make it clearly visualized, we'll remove this gland and we'll see the structures in detail. So if you see here, parotid region or parotid bed, it's a facial line space which forms mold or bed for the parotid gland. In front, posterior border of ramus of mandible with masseter and medial pterygoid. You can see here, posterior border of ramus of mandible with masseter and medial pterygoid. Behind, mastoid process and sternocleidomastoid muscle. Mastoid process and sternocleidomastoid muscle. Above, external acoustic meatus and posterior part of temporomandibular joint. So external acoustic meatus and posterior part of the temporomandibular joint. So below, posterior of digastric and styloid muscle. Posterior of digastric and styloid muscle. Medially, styloid process and styloid group of muscles. So here you can see styloid process and styloid group of muscles. So this forms the parotid bed. Parotid gland, it's a salivary gland, largest of the three glands. So the three glands are parotid, submandibular and sublingual. Out of the three, parotid gland is largest. It is inverted pyramidal shaped, approximately weighs 25 grams. So it is covered by two capsules. The true capsule formed by condensation of the fibrous stroma of the gland. False capsule is formed by the investing layer of deep cervical fascia, which splits to enclose the gland. You can see here, this is the superficial layer. Above it is attached to zygomatic arch. Anteriorly, it blends with the epimysium of masseter and forms the parotidomasseteric fascia, the only deep fascia in the face. The deep layer is attached to tympanic plate and styloid process. So it is thickened to form the stylomandibular ligament. This ligament separates the parotid gland from submandibular gland. Sometimes this is also pierced by the facial artery. So superficial lamellae attached to zygomatic arch blends with epimysium of masseter and forms parotidomasseteric fascia. Deep lamella is attached to the tympanic plate and styloid process of temporal bone and thickened to form stylomandibular ligament. Stylomandibular ligament separates parotid gland from submandibular gland. Sectional features of the parotid gland are studied under following headings: the apex, otherwise the lower end; base, otherwise the upper surface or superior surface; three borders, anterior, posterior and medial borders; three surfaces, anteromedial, posteromedial and superficial. So apex overlaps posteriorly of the digastric, appears in carotid triangle. Structures related to it are the cervical branch of the facial nerve, anterior division of the retromandibular vein and formation of external jugular vein. You can see here, this is the cervical branch of the facial nerve, this is the anterior division of the retromandibular vein, and this is the formation of the external jugular vein. External jugular vein is formed by joining of posterior division of retromandibular vein and posterior auricular vein. And here you can see the anterior division of retromandibular vein joining with the facial vein to form the common facial vein. So apex is related to three structures, namely the cervical branch of facial nerve, anterior division of retromandibular vein and formation of the external jugular vein. Base, otherwise called the upper surface, it is concave, related to external acoustic meatus and posterior part of the temporomandibular joint. Structures related are the temporal branch of the facial nerve, superficial temporal vessels and auriculotemporal nerve respectively, from anterior to posterior. As you see here, so this is the temporal branch of the facial nerve, this is the superficial temporal vessels and this is the auriculotemporal nerve. This is the base. So then anterior border, it rests on the masseter, separates superficial surface from anteromedial surface. Structures related to it are from above downwards: zygomatic branch of facial nerve, transverse facial vessels, upper buccal branch of facial nerve, accessory parotid gland and its duct, parotid duct, lower buccal branch of facial nerve, marginal mandibular branch of the facial nerve. So let us see the structures: zygomatic nerve, transverse facial artery, upper buccal nerve, parotid duct, accessory parotid gland and its duct, lower buccal nerve and marginal mandibular nerve. So posterior border rests on sternocleidomastoid muscle, separates posteromedial surface from superficial surface. Structures related are posterior auricular branch of the facial nerve and posterior auricular vessels. You can see here posterior auricular artery and posterior auricular nerve. So medial border separates anteromedial surface from posteromedial surface. It comes in contact with the pharynx, so-called pharyngeal border. You can see here. So this will be the medial border. This is the anteromedial surface. This is the posteromedial surface. This will be the anterior border. This will be the posterior border. So then superficial surface, Covered by skin, superficial fascia, posterior fibers of platysma, superficial lamella of parotid sheath, superficial group of parotid lymph nodes, and branches of great auricular nerve. You can see here. So this will be the superficial surface. From outside inwards, it will be the skin, superficial fascia, platysma, and then the superficial lamella of the parotid sheath with superficial parotid lymph nodes. Then anteromedial surface, deeply grooved for the ramus of mandible. Relations are masseter, mandibular ramus, capsule of temporomandibular joint, medial pterygoid muscle, branches of facial nerve from the outer lip of the groove, maxillary artery from the inner lip of groove, only near the neck of the mandible. So we will not be seeing in the diagram. You can see here, this is the groove in the anteromedial surface. You can see this is the ramus of the mandible. So this is the masseter and this is medial pterygoid. From the upper lip, you can see the branches of the facial nerve. Then posteromedial surface, it is related to the mastoid process, sternocleidomastoid muscle, posterior belly of digastric, styloid process and styloid group of muscles, transverse process of atlas and rectus capitis lateralis, and deep to styloid process, there will be internal carotid artery, internal jugular vein, and 9, 10, 11, 12 cranial nerves between them. So facial nerve, after emerging from stylomastoid foramen, pierces upper part of this surface before entering the gland, and external carotid artery lodges in a groove in lower part of the surface before entering the gland. You can see here. So this is the mastoid process. This is sternocleidomastoid. This is posterior belly of digastric. This is the styloid process with styloid group of muscles. You can see the internal carotid artery, internal jugular vein, and you can see the 9, 10, 11, 12 cranial nerves. And you can see this is the transverse process of atlas. So now few processes of parotid gland, that means the parotid gland extends into nearby regions like processes. One is the facial process along the parotid duct. The other one will be the accessory parotid gland and its duct. When we are dealing with the relations of the anterior border, I have shown you the accessory parotid gland and its duct. It's a small part of the facial process detached from it, lies between zygomatic arch and the parotid duct. Pterygoid process, it is between the medial pterygoid muscle and mandibular ramus. Glenoid process, it passes upwards between external acoustic meatus and the temporomandibular joint. Pre and post styloid process, in front and behind the styloid process. You can see here, this is the styloid process, this will be the pre-styloid, and this will be the post-styloid process. So as you see, there are 4 to 5 process: facial process, accessory parotid gland and its duct, pterygoid process, glenoid process, and pre and post styloid process. So internal structures within the substance of the parotid gland from superficial to deep, there are 3 important structures, namely the facial nerve, retromandibular vein, and external carotid artery. From superficial to deep, nerve, vein, artery. So facial nerve, then retromandibular vein, which is formed by the union of superficial temporal and the maxillary vein. So then inferiorly divides into anterior division and posterior division. Posterior division joins with posterior auricular vein, which forms the external jugular vein. Anterior division joins with facial vein, which forms the common facial vein. So then this will be the external carotid artery from superficial to deep, nerve, vein, and artery. So facial nerve, you can see here, after emerging from stylomastoid foramen, it enters into the substance of the gland through the upper part of the posteromedial surface. So within the substance of the gland, it divides into a temporofacial trunk and cervicofacial trunk. Temporofacial trunk will divide into temporal branch. Temporal branch will go through the base, whereas the zygomatic branch will emerge through the anterior border. And then cervicofacial trunk will have 3 branches: buccal, marginal mandibular, and cervical. Cervical goes in relation to the apex of parotid gland. Marginal mandibular emerges through the anterior border, and even buccal branch will divide into upper buccal and lower buccal and emerges along the anterior border of the gland. So here you can see the Patty's faciovenous plane or neurovenous plane, where this facial nerve divides the parotid gland into a superficial lobe and a deep lobe connected by isthmus. So this plane will help us to excise any kind of superficial tumors of the parotid gland easily without damaging the facial nerve and the deeper structures. So you can see this is the temporofacial trunk and this is the cervicofacial trunk. And here comes the parotid duct, otherwise called as the Stenson's duct, which emerges from the anterior border. It will be formed by 2 vertical ducts, one from above and one from below. Both will join within the substance of the gland and form single parotid duct, which emerges from the anterior border. So it opens on a papilla opposite the upper second molar tooth. So it is approximately 5 centimeters in length, 3 millimeter in wide, formed by union of two vertical ducts within the gland. Course emerges from anterior border of the parotid gland between upper and lower buccal branches of facial nerve, passes forward and masseter. At anterior border of the masseter, turns medially, passes through buccal pad of fat, pierces buccopharyngeal fascia, pierces buccinator muscle, so passes obliquely forward between buccinator and mucous membrane of the cheek. So this course is acting like a valve which prevents the blowing of air into the parotid duct while forceful blowing of air. So prevents the entry of air into the parotid duct while there is forceful blowing of air like blowing a trumpet. So opens in vestibule of mouth opposite upper second molar tooth. You can see here emerging from the anterior border, resting on masseter, at anterior border, turning medially, passing through buccal pad of fat, buccopharyngeal fascia, buccinator, then passing obliquely and opening on the parotid papillae close to the upper second molar tooth. So blood supply, mainly supplied by the external carotid artery and superficial temporal artery branches. Veins drain into retromandibular vein and external jugular vein. Lymphatics, superficial parotid lymph nodes lies in superficial fascia over the gland. Deep parotid lymph nodes lies deep to parotid capsule. Finally drains, both of them drain into deep cervical nodes. So nerve supply, auricular temporal nerve and great auricular nerve. Sympathetic plexus around external carotid artery, which are derived from postganglion fibers from the superior cervical sympathetic ganglion. Preganglion fibers comes from T1 segment. So stimulation causes thick, sticky secretion. So parasympathetic secretion, it is more or less like the OT ganglion. So you can see the inferior salivatory nucleus from medulla oblongata. Fibers pass through glossopharyngeal nerve, tympanic branch, and then tympanic plexus, lesser petrosal nerve, otic ganglion. There is relay in the otic ganglion, then postganglion fibers pass through auricular temporal nerve and reaches the parotid gland. Stimulation produces watery secretion. So applied aspects. So mumps is a viral parotitis of the parotid gland. Then Fraze syndrome, parotid xylogram, stones in the parotid duct, parotid abscess. So this is very important. See, parotid abscess will be drained by a horizontal incision, which is called as Hilton's method. So this horizontal incision is important because this horizontal incision will help us prevent the damage to the facial nerve. If we give a vertical incision, we will be damaging the branches of the facial nerve. So then we'll be inducing lower motor neuron type of facial palsy. So always parotid abscess, we should prefer draining it through horizontal incision, which is called as Hilton's method. So let us see. So this is the viral parotitis, mumps. So there is a vaccination called MMR vaccination, measles, mumps and rubella, to prevent mumps. You can see the few symptoms. It is more or less like a viral symptoms like fever, headache, loss of appetite, muscle aches, tenderness, all these things, because the swelling is too much and the capsule around the parotid is not yielding, so it will be very painful. Even eating will be very difficult. Opening the mouth is very difficult due to pain. Fraze syndrome, the most important, either after penetrating injury or after parotid surgery. Okay, so which leads damage to the auricular temporal nerve and great auricular nerve. During healing, auricular temporal joins with the great auricular nerve through which fibers reach the sweat gland. So what happens when patient tries to eat? Beads of perspiration will appear on skin covering the parotid gland. So that means stimulation which was intended for salivation is producing the sweat. So this is called Fraze syndrome. And you can see this is the parotid xylogram. You can see this is the inflamed gland and this is the irregular duct. So you can see the teeth. So this is the parotid duct opening into the vestibule of the mouth. So this is a parotid xylogram. Xylogram is study of the salivary glands, and this is parotid salivary gland, parotid xylogram, especially in which we are studying the parotid gland and its duct. So you can see here there is a stone in the course of the parotid duct, and you can see the duct which is proximal to the stone is dilated and even there is inflamed gland. Thank you.